I'll just comment on the part about talking to the patients. And what he's talking about is that I like to ask a trick question to my patients when they would come, and I'd say, they'd sit down in the office and say, "Why are you here?" And they'd say, "Wait a minute, you're the doctor. Don't you know?" And I said, "Well, I do. I sort of know why you're here. People sent me some records, but I want to know, I know you need an operation. I know that's the plan. I know that that's what we'll do if that's what you want. What I really want to know is why you want to get well. What are you going to do when you're well again?" And I want you to think about that, and almost as a mantra or as a method of putting your mind on what's important to you. Because people, they don't know what their assignment is. They think their assignment is to be worried. They think their assignment is to ask you a gazillion questions. Now, I did learn after a time that if I did that, they would talk to me about whatever they want to do. Ride a motorcycle, drive a convertible, whatever. It saved me some time. I didn't have to answer 100,000 questions on how big the vessels are, how many stitches we're going to take. Basically, they wanted to talk. They were very happy to talk about things that were important to them. But it was very powerful, actually, to get the people to think about who they were, what they were about, what they wanted to do when they were well again. And so the part of that picture I didn't know this. I didn't think of this at first, actually. But it did have a ulterior motive that I would have pictures of all these patients doing fun things that I could, enjoy seeing. But the real mission was to get them to think about very clearly staging the picture. What will it look like when you're scuba diving again? I want to see a picture of you full of regalia. I did get one picture of a guy. He was actually a special forces guy. He had injured his femoral artery parachuting out of a plane, and he wanted to be a triathlete. He wanted to be a triathlete, and he was having trouble. And a very driven guy. Asked if I do this special operation for him. We did it. So he sends me this picture of him, his best time ever. And of course, he's got his speedo, right? One of my friends said, I really don't get this. You got a picture of a guy in a bathing suit in your office. There's nothing to it. I just thought he was a cool guy, and the story was cool. But anyway, in essence, what it revolves around is the idea of making the patient a performer. And it's easy when you talk to a player. Right? It's obvious that they're performers or an actor or a musician. It's not quite so obvious that the patient is part of that team that we talked about. And eventually, we came to think of that a lot, about how we could help them be the best performers that they could be, and how we had neglected that initially. So I thought, I do think that's a very powerful concept. And I know that you understood that and liked hearing about that. I think that's something that's quite good. And of course, for you as a patient, you need to take ownership of that. Everybody here, one of the things I say to the students when we're getting ready to talk about surgery, it's only 10% of people will be surgeons in our class. The other 90% of you won't, but everybody will have an operation. All of your patients and you and all of your family. Someday, sooner or later, if you live on, if you have an operation, how will you be ready for that time? Or how can you be ready? How can you get ready for that time? And the answer is, don't focus on the operation, focus on the recovery, focus on what you're going to do again. And that puts your mind in a good place. And I guarantee it, people that have seen this, I've never had videotape, it seemed too intrusive, but if you talk to somebody, often they'll come in, they're in their bed and they're like this. And you start talking to them about, stuff like that. And you just do like this and say, oh yeah, I got this black Miata. I drive it up the Bush Parkway. And the next thing you know, there's no more talk about the operation or anything. We're talking about driving on the Parkway with the top down. And how cold do you let it get before you put the top up, that kind of stuff. So we're no longer talking about things that they have no control over. There's no reason to talk to me about what size suit you're wearing, things like that, right? And they know that. So it empowers them. And I think that's that's a very potent tool, I think, that we can teach people.